Welcome to Breakfast with Spaniels with Dr. Judy Morgan.
She's so far back in her hidey hole, I can't get her out. Don't be so stiff. Say hi. Say hi. You smell good. Yeah, you still smell like jasmine and lily. I don't want your kisses. I don't want your kisses. Yeah.
Remember, you can purchase all of Dr. Morgan's products at her website at www.drjudymorgan.com.
Should I?
Now it's time to sit back, relax, and enjoy the show.
Morning, everyone. Yeah, that was a quick hi from Stewie. Yeah, it's close enough. Quick hi from Stewie. Little Gabby has decided she really likes the hidey hole under the desk, and she gets so far back in there, I have to get down on my hands and knees and get under the desk to get her out all the time. So we have been getting lab work on all of our animals. I think I mentioned last week that we had taken the cats to the office, and then we got lab work from all the dogs. And for the most part, things came back pretty good. My mom's dog, Shotzi, is still struggling with anemia. But even more surprising was a couple of our dogs came back anemic. And that was a little surprising to me. And one of our cats, Buddha, the crazy one, he came back with a high CPK. And I've talked about CPK in the past. It's a muscle enzyme. And how did my trip to the dentist go? I went in, he looked at it, he said, yep, needs a crown. That'll be $103. See you next week. So that's how that went. So I'm going back next Monday for step one. Anyway, but so Buddha's CPK came back high, and CPK is a muscle enzyme. So a lot of times when it comes back high, we think of heart disease, because the heart's a muscle, and the CPK will commonly be high in dogs or cats with heart problems. Well, Buddha doesn't have a heart problem that we know of, doesn't have a murmur. But in kitty cats, when we get a high CPK, one of the things that we want to look at is a disease called Toxoplasmosis, which is actually a parasite. A lot of people are familiar with Toxoplasmosis because that's the thing they tell us not to eat raw meat when we're pregnant, because toxo can go through the placenta to the fetus and cause birth defects. So actually, one of my friends, when I was pregnant with my son, it was my first child, so 31 years ago, our neighbor across the street was pregnant at the same time, and she got infected with toxo. She had been in Japan and ate raw beef that had that they surmised that's where she got it. So when you're pregnant, you shouldn't eat raw things. But anyway, so I said $100 beats the money they charge for a root canal or implant. Yeah, but the cap is going to be God knows how much. That was just the peek at it to say that we need something. Anyway, so I said, I called the office and I said, can you ask the lab to run a toxo titer on Buddha? Let's see if that's where the problem is. And if it's not that, then I'll take him to see the cardiologist. Well, lo and behold, a couple days later, got our results back. Buddha's positive for toxo. So now he has to go on antibiotics to kill. It's a little one-celled organism. So now he's got to go on antibiotics for that. And he's not easy to medicate. It is not going to be fun. I don't quite know how I'm going to get this done, but we'll figure that one out. So that was So we've got a couple of animals that are anemic, so they're on supplements for that. We've got, I should bring home the Cebu Tong for them, honey. So we've got some anemia we have to deal with. Then we've got the cat with a positive toxo test. And then Shayna, who has been leaking urine, and her urine smells kind of I thought, well, you know what? Let's just do a urine culture just to rule out anything more sinister. Oh, for Pete's sakes, she has 3 nasty bacteria growing in her urine, and one of them happens to be a methicillin resistant. So the only antibiotic that will get there's 2 antibiotics that will get all 3 of the bugs that she has in her urine. One is chloramphenicol and the other one's amikacin. Amikacin can only be given by injection, and it is very hard on the kidneys. So even though her kidney function is pretty good, as far as we know, at her age and with her heart problems and everything else, giving her amikacin is probably not the best idea. So we opted for chloramphenicol. The problem with chloramphenicol is in rare instances, it can cause bone marrow suppression. But this is one of those darned if you do and darned if you don't. So of course, we've upped her supplements for bladder health, but we got to get rid of this problem. And I'm very concerned that a lot of this problem may be coming from her mouth because her teeth are so bad, because the cardiologist recommended that I not do her teeth a couple of years ago. But I have her scheduled for October 20th to have her teeth done, which is good because I can get this antibiotic into her between now and then and hopefully get that under control. So I love holistic medicine. I love using herbs and other treatments, but there are times when we got to bring out our traditional medicine as well, and this happens to be one of those. So fun and games, it's sort of like the more kids you have, the more doctor's visits you have, the more fun you get to have with all of them. So interestingly, I've had care credit for years for the dogs. I'm going to get to use care credit on me. As I was walking out of the dentist office, I said, do you guys take care credit? Why, yes, we do. Awesome. So I'm going to use care credit for my tooth. Risk versus benefits. I know this is one of those. Stewie's, if I remember right, all of Stewie's lab work was normal, wasn't it?
Yes.
Stewie was not anemic. His albumin is a little low. His albumin is a little low. I think he has a little tiny bit of leaky gut or inflammatory bowel, because he can sometimes be difficult to get him eating, although lately he's been really good. So anyway, okay, fun and games with lab work. All of you have a wonderful day. I'm off to the office, where apparently one of our technicians called out sick today, which is always worrisome these days. So we're short. And I was going to take Stewie and Gabby to get spayed and have a dental, and Stewie to have a dental. Stewie's going to stay home. I'm going to take Gabby, and if we get to her, we get to her. And if we don't, she goes back another day. And Gabby's lab work was perfect. You get tired between just your 2. Love care credit. Yeah, awesome. What do I do when Stewie gives me a hard time eating? I hand feed him. Gabby likes to be spoon fed too. I think they just want the attention. I'm not spoon feeding you, honey. When you get to the point where you need to be spoon fed. Bye, everyone.